So kind of just using the nursing process here, we go to assessment. So take a minute and assess what you are feeling. It can be at home, it can be before clinical, it can be after clinical. Just take a minute and assess what you are feeling. Are you feeling fatigued? Are you feeling tired? Are you feeling that loss of passion? Or if you're in the moment, assess what you were about to do. Did you do the 5 rights of medication? That right dose, right drug, right patient, right route, and right time. Did you do that twice to make sure you were right? Did you read that decimal? Is there a decimal? Or did you take that extra minute to educate the patient? Did you ask them, do you understand? Did you ask them, okay, can you demonstrate that? Diagnosis. Identify that feeling. Are you feeling burnt out, depressed, anxious, anything? Or that you may have a near miss event, or that you forgot an important point for the patient to know. In planning, figure out how you are going to help with your burnout, such as counseling or self-care, or how you're going to prevent yourself from causing an error again. Implementation. Take the time to do your self-care or go to the counseling appointment. Take the time off, or for the self-care, do it before clinical, do it after clinical, anything. And do the method to help you prevent the errors again. Do whatever makes you feel like you'll not do this error again. And at the very end, evaluate. Did your interventions help? Did they work? Would you do anything differently? If you're going to do anything differently, then you're going to have to do the entire nursing process again. And then my nursing meta paradigm isn't a lot, but I really wanted to focus on nurses. Because my philosophy is, if I can't help myself, how am I going to help others? I need to help myself first before I can help the next person. So, for person, I have nurses. They need as much help as the next person. And nursing, with communication, speaking out, collaboration, working with others, and interpersonal relationships, help me help you. Communicate your needs, or if something is not right, or maybe you not know something, speak out about it. If you don't voice your concerns, issues will never get addressed. Collaborating with helping a coworker if they're struggling, because we're all part of the same team. We're all trying to get the day done, and we're all trying to keep patients satisfied and happy, and we got all of our tasks done. Help out if you can. Keeping up with good interpersonal relationships help both yourself and the person. When you are struggling, you can seek out the people who you get along with the most. They can help you with work or any other mental health concerns. Environmental. So there's internal and external factors. There's motivation in yourself, and then appreciation and knowledge. So the internal factors, you need to assess yourself and your motivations to help you navigate how you are perceiving this profession. And external is, nurses should be appreciated for their work and need to continue their education to keep up with the changes in the medical field. And again, with the solution is, with medication errors and floating nursing, managers should take the time to educate the floating nurses for the medications on the floor. And then health. So we have mental health, coping, and adaptations, and then stigmatism, how you define coping stressors, and how do you work with change. So for mental health, it's tough for nurses, like I said, to get the resources because they're afraid of what their coworkers would say. They need to know how they define their own mental health, and are you redefining your condition, or are you ignoring the issue? And then coping. Are you dealing with the stressors? Are they good coping mechanisms or bad coping mechanisms? Adaptations. How are you working with or against change? Are you working with it, or are you working against it? Then I have Lewin's theory. We've all know this one. It's that unfreeze, transitional, and refreezing. But I thought this would fit best for all the solutions that I stated. So there's unfreeze and introduce solutions such as having a staff meeting about the changes. Transitional, start implementing the change. And then refreezing. Everybody has adjusted the change and are now working with the new normal. Example 1 solution is the virtual nursing. As you know, Epic is a technology that is somewhat new, but back then everything had to be done by paper. So to implement this change, everybody had to sit down, learn about Epic, have to go through this change to switch over from paper to computers, and everybody got used to it. That's Kurt Lewin's theory. Then for a nursing theorist, I went with Dorothea Orem, self-care, because this is all talking about mental health and to stop this ripple effect happening. So this helps know which stage you are in to figure out how well you are coping. So the wholly compensatory, there's the working demands and things to do outside of work. So nurses have to go through work with answering call bells, doing assessments, administering medications, and communicating with the healthcare team. Then after their shift is done, they have to go home and they have to clean, cook food, take care of kids if they have any, and have a social life. Nurses have this self-care deficit that they cannot take care of because there is no time to address it. This is when nurse managers or nurses need to start talking about resources to cope with stress and burnout. The partially compensatory. So this is when you're starting to find these resources. Or maybe the nurse manager is starting to have staff meetings about it and providing those resources. And then supportive education, that continuing to find resources and practicing them. Nurse managers may take the time to go over training for burnout and demonstrate some self-care techniques. Nurses need to now recognize where they are at mentally and talk with nurse managers about burnout or stress, or do more research on how they can cope with it. Then for the management theory, I went with Frederick Herzberg, and his is talking about like this motivation and hygiene factor, and it's not the cleanliness type hygiene. So this theory, with the motivation factor, there's extrinsic and intrinsic. Extrinsic is the bonus pays, that advancement in education, the recognition you're getting. And then intrinsic is that feeling of achievement, the wanting to grow, the expressing of interest. So kind of an example with that is the virtual nurse example that I went with Epic. Some people probably did express interest with changing over to Epic and wanting to learn about this technology because they know that this is probably going to help them. Then there's the hygiene factor. This kind of ties into what's going to motivate them. There's negative and positive. And so negative is that low pay, poor conditions. This really isn't going to help them with wanting to do the change. And then there's positive, like the good pay and the good positions and conditions. And then another application is to help with nursing retention. The nurse manager could provide bonus pays if the nurse's performance are good. This will help with nurses wanting to do better in their performance. Another one is if the manager wants to bring in virtual nursing, they would ask the team to help out to make the project more satisfying, and it allows the nurses to express interest and grow on their technology skills. And then just some resources if we wanted to do any of the solutions that I've given out is that time, money, and communication. So time, we need to have time for staff meetings to go over these mental health resources and how to identify burnout. Also just have to have time for self-care or appointments. And then money. If hospitals want to provide nurses with bonuses, they need to make sure each unit is making money and retaining nurses to keep the incentive. And then communication. Nurses need to understand to not be afraid to speak up about mental health issues or mistakes they made. Allow the nurse to grow and learn from their mistakes. I know that like some mistakes can cause disciplinary action where they could be suspended or fired or may have their license removed, but we can't make that as a fear. We need to make it as a learning opportunity and to grow for everybody. So, let's go back to the scenario with a few minor changes with Lisa. So we all know Lisa, she's new grad, got off 2 weeks of orientation. Now she's working with 7 patients on her shift, but now her floor hired 2 LPNs and 2 CNAs to help the nurses. Lisa has also recognized burnout in her recent staff meeting and can find resources to help her through it and prevent it later on. Lisa feels a lot better during her shift and is delegating tasks to LPNs and CNAs. With her outstanding work, Lisa got an added bonus of $100 and a thank you card from upper management for all the hard work she has been doing. See how that scenario was a lot more different than the first one? These are some of the solutions that have been in place. Like, put yourself in Lisa's shoes and think about it with the first change to now. I would feel burnt out if I had no help, no resources, if I was just thrown in. But now, with Lisa's scenario, I feel a lot better about it. So, that is the end of my presentation. I want to thank you guys and to keep in check with your mental health and get involved with change to make this workforce better. And then just my list of references are right here. And I'm done. Thank you guys for listening. And again, I'm sorry you can't see my face, but I have to, my computer is just not working. Thank you again for being patient. And